Hello and welcome again to my blog Sumud. This week I'm discussing life in the desert under conflict, the health of Bedouins in Palestine. During my childhood, I always passed by these sandy hills during car rides from Jerusalem to Jericho for weekly family gatherings in the winter season. I remember how much I enjoyed gazing at the Bedouins and their tents, watching from afar how they gather around fires in groups and enjoying the scenes of shepherds walking their sheep. I was always wondering, how can our lives be so different when we live only 15 minutes away? I had a closer encounter in 2018 when I joined a non-governmental organization that supported mobile clinic visits to Bedouin communities, among other projects. I always enjoyed visiting and talking to community members about their health and health needs during these field visits. I also learned more about the Bedouin culture and have always admired their humbleness, generosity, wittiness, and resistance in the face of injustice. I no longer work with the same organization, but still enjoy visiting the communities and like to support the local women's wool needle felting project. A few weeks ago, I visited Said, name changed for privacy, in the Khan al-Ahmar area to ask her about the health situation in her community. Social and political situation. Area C, which represents 60% of the West Bank in Palestine, is where Israel maintains full military and civil control. In this area, Israel bans the 180 to 300,000 Palestinian residents from constructing infrastructure and buildings, even for housing, health, education, or agriculture. Most Palestinians living there have no access to regular water or electricity. The community living in Khan al-Ahmar is one of many communities in Area C facing threats of forced expulsion by Israel. This expulsion enforces an ongoing plan to expand nearby illegal Israeli settlements. As a result, native Bedouin communities are facing violence from Israeli settlers and military and destruction of their crops and buildings. This in turn results in increased threats to their traditional way of earning a living and accessing food through herding. Most Bedouins are facing poverty and about 80% are food insecure. Healthcare services. These are based on a short interview with Said. How do you access healthcare services nowadays? She says, we receive basic healthcare services through mobile clinic visits twice a month. A general practitioner visits us, but no specialized doctors like a woman doctor or a dentist. These visits have not been consistent over the past few years. They are sometimes interrupted due to underfunding. What do you do if you need specialized services? She answers, we go to another city, either to Jerusalem or Jericho, which are both difficult to reach. They are far away and most community members don't have cars. Only one family in our community has a car, which is not enough for all of us. In cases of emergency, it is difficult to transfer the patient to hospital, and ambulances aren't able to come here due to the sandy and rocky terrains. These have been cases when women could not reach hospitals for delivery and had to deliver their babies in the tents on the way to the hospitals or at military checkpoints. How has the healthcare situation here been during the COVID-19 pandemic? She says, it has been difficult. Mobile clinics stopped visiting us for many months at the start of the pandemic as a result of lockdowns and underfunding. Chronic disease patients like myself were not receiving the regular medications and had to go to a faraway clinic or hospital to purchase it at my own cost. Were you provided with any outreach services such as COVID-19 testing or hygiene kits? No, we were never tested for COVID-19 by mobile teams, she says. She continues, we were provided with 2 educational sessions on COVID-19, its symptoms and prevention. We were told that whoever suspects they are infected should go to the nearest clinic or hospital to be tested. We used to receive hygiene kits, which include tissues, cleaning products, diapers, feminine products, and other household items a couple of years ago, but since the start of the pandemic, we are no longer receiving these. Saeed is one of thousands facing the same threats every day. It is evident that political and social factors are key determinants of the Bedouin population's health in Palestine. Political constraints for development, threats of displacement, lack of work opportunities, and poverty all aggravate the Bedouins' inability to access healthcare. The solidarity of international organizations and states against the ethnic cleansing of native populations in Palestine and elsewhere in the world is an essential advocacy effort to end this injustice. Without challenging the current political practices, these Bedouins will remain unable to practice the right to health and right to existence.